Shri Sampath Kumar, Principal Secretary, Department Health and Family Welfare, Government of Meghalaya, has informed that the state has got its own laboratory to conduct genome sequencing of the COVID-positive cases, including Omicron subvariant BF7. Kumar informed that all the positive cases are being put for genome sequencing, adding that fortunately the state has very few cases at present. He said that the state is gearing up in terms of preparedness as the cases are rising in China, Japan, South Korea, France and the United States. Kumar said that the health department managed to put in place a very good system during the first and second wave of the pandemic through the Integrated Disease Surveillance Program unit. He also informed that between December 12 and 18, 2 new cases were detected. The number of tests conducted during the period was 212 in East Khasi Hills, 25 in Reboy and 129 in West Karo Hills. The positivity rate in the past 7 days was 0.
Essentially, in terms of the preparedness, we have this Integrated Disease Surveillance Unit, IDSP program. So, based under that, we have already kept very good systems in the state during this previous, the COVID wave 1 and wave 2. We have good infrastructure. We are again looking at everything, all the things, that oxygen support systems to everything. If there is any eventuality, we are well prepared, but we are working on it in the sense like taking the stock of everything, how every function is working and put in place.
Home Minister Shri Lakmin